Welcome back. This is Brilliant East, yours me Godfrey. This is video number 4, internal medicine. Question number 31. A 33-year-old woman is otherwise well present to the emergency department with symptoms of recurrent episodes of hemoptysis. She has no fever, weight loss, cough, or sputum production. She is not experiencing any dyspnea or chest discomfort and is not taking any medication. She works in an office setting. Report on travel history, and her family history is negative for lung disorder or breathing disease. Her vital signs, oxygen saturation, and physical examination are entirely normal. The chest X-ray, biochemistry, complete blood count, and coagulation profile are also normal. Which of the following is the most appropriate initial diagnostic test? The answer is C. This is because CT scan can tell what is the cause of hemoptysis. Ever since, according to the question, the patient seemed to work in the office and travel on travel history, which is the risk of acquiring TB, but the chest X-ray is entirely normal. So with CT scan we can be able to know where is hemoptysis taking place in the lungs of the patient. Because of recent technology, CT scan is very useful. Question number 32. Miss Ashura, a 55-year-old woman with a past medical history of hypertension, present to the emergency department because her tongue and lips feel swollen. During the history, she tells you she recently started a new blood pressure medication. Her only other medication is a baby aspirin. Her vital at triage blood pressure of 130/74 mm of mercury, heart rate of 85, respiratory rate 16 beats per minute, temperature of 36.7, and oxygen saturation of 99 on room air. On physical examination, you detect mild lip and tongue swelling. Over the next hour, you notice that not only her tongue and lips are getting more swollen. Over the next hour, you realize she's getting swelling of the lips and the tongue, but her face is also starting to swell. Which is the most causative agent among those medications? The answer is D. It's lisinopril. Most ACE inhibitors are the cause of drug-induced angioedema. Question number 33. Makala, who is a 41-year-old restrained driver, has been involved in a high-speed motor vehicle collision, is brought to the emergency department. The patient is breathing without difficulty and has bilateral and equal breath sound. He has strong peripheral pulses. His heart rate is 121 beats per minute. His Glasgow Coma scale is 14, and the secondary survey revealed bruises of the chest wall. You are concerned about a possible cardiac injury. Which area of the heart is most commonly involved in cardiac contusion? The answer is B. It's right ventricle. Right ventricle is just behind your sternum, your collarbone. So when you are in the motor vehicle, you are likely to hit the collarbone, which hit the right ventricle and develop a contusion of the cardiac contusion. Question number 34. A 20-year-old boy arrived at casualty with multiple stab wounds on his chest. His blood pressure is 85/50 millimeter of mercury, that is hypotension, and heart rate is 123 beats per minute. Two large bore intravenous lines are established and IV fluid are running wide open. On examination, the patient is mumbling incomprehensibly, has good air entry on lung examination, and has jugular venous distension. As you are listening to his heart, the nurse calls out that the patient has lost his pulse and that she cannot get a BP reading. Which of the following is the most appropriate next step management? The answer is D. Emergency thoracotomy. So you need to immediately do a surgical procedure. Question number 35. A 19-year-old boda is brought into resuscitation room by his father after a head-on cycling accident. The patient was not wearing a helmet. Upon presentation, his blood pressure is 125/75 millimeter of mercury. Heart rate is 105 beats per minute. Respiratory rate is 19 beats per minute, and oxygen saturation is 100% on 10 liters of oxygen via face mask. His eyes are closed, but he opened them to verbal command. He also moves his arms and legs on command. When you ask him questions, he is disoriented but able to converse. What is the patient's Glasgow coma scale? The answer is C. So you can calculate the Glasgow coma scale on eye opening, motor response, and verbal response, as you can see from the question, and then you get the answer is 13. Question number 36. You are on duty in the emergency department when you are notified that an explosion and mass casualty event has occurred. The first patient, an approximate 30-year-old man, arrived poorly responsive and confused. He is sweating profusely and vomiting, with an episode of diarrhea. Vital signs include blood pressure of 170/90 millimeter of mercury, high blood pressure, respiratory rate of 22 beats per minute, heart rate of 55 beats per minute, temperature of 37.0 degrees centigrade, and pulse oximeter of 93% on room air. He requires frequent suction of his airway. His pupils are pinpoint and he has prominent layers on lung exam. After you clear and control the patient's airway, what is the appropriate initial pharmacological therapy? The answer is A. You need to give him atropine. As you can see, the heart rate is dropping, so atropine would help to raise the heart rate compared to this other medication. Question number 277. Miss Maria, a 60-year-old woman with a history of diabetes, is brought to the emergency department by Samaritan who states that the patient was found in the bath in a lethargic and diaphoretic condition. Her point of care glucose level at the emergency department was 1.9 millimole per liter. Oh my god, that's severe hypotension. At emergency department, you quickly administer dextrose through an IV line. The patient becomes alert and responsive, stating that she just took her normal medication. Her blood sugar went up to 6.1 millimole per liter, and she remained in that throughout the time at the emergency department. However, in the ward after being admitted. You note that the patient is again diaphoretic and is mumbling her speech. Her glucose level is now 2.6 millimoles per liter. Glucose has dropped again. You administer dextrose and she improves, which is a foreign diabetic medication commonly causes hypoglycemia, for which the patient is likely to require hospital admission. The answer is C, glybride. This is a sulfonylurea. Most sulfonylurea has highest risk of hypoglycemia, and when patient takes sulfonylurea have to be very careful, and if they get hypoglycemia they should be well managed. Question number 38. You receive a 34-year-old man with a history of severe asthma at the emergency department with sudden onset difficulty in breathing. Vital signs include respiratory rate of 36 breaths per minute, temperature of 37 degrees centigrade, and oxygen saturation of 85% on room air. Despite aggressive treatment, he requires emergency endotracheal intubation. He is given etomide and succinylcholine for rapid sequence induction. Shortly after intubation, he develops muscle rigidity and a temperature of 400 degrees centigrade. Which of the following is the most appropriate next step in treatment? The answer is B. Administer dantrolene, because dantrolene will help to reduce the muscle rigidity of the patient. Question number 39. A 7-year-old girl with known history of sickle cell disease and a previous history of admission for acute painful crisis presents to you with a 1-day history of fever and cough. She is tachypneic and on presentation with a temperature of 80 degrees centigrade. Temperature has increased. Auscultation of the chest reveals layers on the right. On chest radiograph confirm the diagnosis of pneumonia. After initial treatment with antibiotics and IV fluid, patients with this condition are most likely to develop which complication? The answer is A. They are most likely to develop acute chest syndrome. This is the complication of having sickle cell disease. Question number 40. A 9-year-old boy with a known history of sickle cell anemia is brought to the emergency department after sudden onset of left-sided hemiplegia. The mother states that her son had rhinorrhea and nasal congestion for the past 2 days, but has otherwise been in a good state of health. What is the best diagnostic modality to evaluate for possible cerebrovascular accidents? The answer is C. Magnetic resonance imaging and angiogram of the head and neck, and this will help to identify if the patient, the boy, may have a possibility of getting a stroke, and usually done several times to sickle cell patients. Subscribe, hit the bell sign, like and share our video. You're with me, girlfriend Oscar. You're warmly welcome.